Hello, my name is Billy Williams, Medicare Health Insurance Options.com. Phone number is 800-499-1942. In this video, I'm going to talk about some important factors for you to consider when you have to make a decision in regards to a Medicare supplement plan. What is the best Medicare supplement plan for you? In this scenario, we're going to assume that you have either turned 65 or you will be turning 65 in the near future, and you do have Part A and Part B of Medicare, or you continue to work at age 65 and at this point have decided to stop working, and you will be getting or have started Part B recently. In this situation, we're also assuming that you have made the decision that you do not want a Medicare Advantage plan. You are not going to enroll in an HMO or a PPO. This means you have decided that you do want Medicare as your main coverage, and you do want to choose a Medicare supplement policy as your secondary plan. The first thing to discuss is the different letter plans that are available to you. And depending on your age, those plans will include Plan F, Plan G, and Plan N are the most popular plans to consider. Now, we no longer really recommend the Plan F, and also if you turn 65 after January 1, 2020, you are not allowed to get a Plan F. So we're really not going to discuss the Plan F in any detail. Therefore, the Plan G and the Plan N will be the two plans that you will need to consider. There's really not a lot of difference between the Plan G and the Plan N. Both of these plans will pay for your Part A deductible. Both of these plans also include a Part B deductible. In the year 2020, when this video was made, the Part A deductible was $1,408. Both Plan G and Plan N will pay the Part B deductible for you, so if you're admitted to the hospital, you will not have any out-of-pocket charges. Both of these plans also have the Part B deductible. In the year 2020, the Part B deductible is $198. The Part B deductible applies to any medical care that you receive that is not an overnight stay in the hospital. So things like going to see your doctor, any type of lab work, testing, treatment, emergency room, ambulance, outpatient, home health care, and etc. That's all covered under Part B. If you have a Plan G or a Plan N each calendar year, you are responsible for the first $198 of medical care that is not a stay in the hospital. Now, if you have a Plan G or plan in enrolling in a Plan G, it's important to note once your Part B deductible has been paid, you will not have any other out-of-pocket expenses. If you do decide to enroll in a Medicare supplement plan in after your Part B deductible has been satisfied, then it's important to understand there are two situations where you may have an additional small out-of-pocket charge. The first is if you go to a routine doctor visit, you will have a cost-sharing payment there or a co-payment somewhere in the range of $15 to $20. And then also if you are treated at a hospital emergency room, you will have possibly a co-payment there up to $50. Now, if you go to a hospital emergency room, you're not admitted to the hospital, that is when that co-payment comes into play. If you are admitted to the hospital, then there is no co-payment. Also, if you are treated at some other local non-hospital emergency facility, there is no co-payment. Generally speaking, the monthly premium on a Plan N is less expensive than a Plan G, and if you're relatively healthy and you do not have a lot of doctor visits each year, looking at a Plan N is a good idea. I have another video. I will post a link to that video in the description to this video below that goes into a lot more detail as far as the plan in and how it works and why you might consider getting a plan in at this time. So if you have decided that you are going to have Medicare Part A and B as your main coverage, if you have decided that you do want a Medicare supplement policy, if you have decided on what plan letter that you want, then the next choice is what company. All Medicare supplement plans are standardized. So let's say, for example, you have decided that you do want to get a Medicare supplement plan G as a secondary to your Medicare. In your area, there are going to be very many companies that do offer the plan G. The benefits of the plan G are going to be exactly the same with each company. This is a good thing because this means that you do not have to analyze and study the different benefits of the plan G from each company because there are no differences. They're all exactly the same. So if there are very many companies selling the exact same plan with the exact same benefits, then who do you choose? It's interesting to note that the monthly premium is not going to be the same with each company. So our philosophy is we do want, of course, to get you a good value, but we also want to consider what company that we're recommending to you. We do want to choose a company that has a good brand name in the marketplace, that has been in business for a number of years, that has a good track record as far as their rating and their paying of claims and their rate increase history and so forth. Now it's important to note here that choosing an insurance company when you first turn 65 or when you first get Medicare is obviously important, but it's most likely not going to be the case that you stay with the same company for all of the years that you are on Medicare. So any company that we represent, any rate that we quote you initially, that rate is locked in for 1 year. After the 1 year mark, it is possible that your rates will go up. Now, a Medicare supplement policy is a guaranteed renewable policy. What this means is that once an insurance company issues you a Medicare supplement, as long as you pay your monthly premium, they can never cancel your policy. They can also never change your benefits. They can also never single you out and raise your rates. If you have a rate increase on your Medicare supplement policy, so does everyone else in your area that has that same plan letter with the same company. The insurance company is required to keep very strict records for each group of people. And as you go through time, the insurance company is required to maintain 80% premiums to claim. So what that means is for everyone that has the same Medicare plan in your area, for every $100 that people in your group pay to the insurance company is required to pay back out at least $80 in claims. They're going to report these figures to the insurance commissioner each year. If they can show that they have paid out more than 80% in claims, they're going to ask permission for what they call a rate adjustment, which is normally an increase. And so you normally will see a rate increase about once each year on your policy, and that is something that as an independent agency we are going to monitor very closely for you. If you do receive a rate increase, the insurance company is required to notify you. We will also know about this rate increase ahead of time, and we will be in contact with you either with a postcard or an email or a phone call. If at some point your premium gets higher than we think it should be, if there's some other good company that we recommend at a cheaper price, we might at some point recommend that you make a change. So that is part of the long-term strategy that we use for our customers, to not only make sure that we put you with a good company initially, but we also make sure that over the years we are continuing to make sure that we're getting the best value that we can for you. So choosing the best company really really depends on a lot of different factors. And if you have an independent agent that is very experienced in your market, knows the different companies and the different carriers that are doing the best as far as stability and pricing and claims and customer service, then you can feel confident that you are in the best place at that time, and you can also have the confidence that if things do change in the future, you're going to have someone there to work with you to make changes whenever they are necessary. So I hope this information has been helpful. If you would like our services to do some research for you, either to help you choose a plan for the near future, or if maybe you have already been on Medicare for a while and have received some price increases and would like to price shop your plan, we would certainly be very happy to speak to you as well. My services to you are always free. We are compensated by the insurance company by bringing them customers, and also we can help you with other types of Medicare related insurance, such as prescription coverage, maybe dental, vision, hearing plans, and so forth. Again, my name is Billy Williams. My website is MedicareHealthInsuranceOptions.com. My toll-free number is 800-499-1942. I hope this video has been helpful, and I look forward to speaking with you in the near future. Hope you are having a great day. Thank you.